Great. The other question we usually have as dog owners is, so we were talking about if the dog has something wrong, go to the vet, but how do you know something is wrong? What are the signs of something is wrong in your dog's mouth?
In the dog's mouth. Okay, so change of behavior. That's always a sign of something in general. Like if your dog changes the behavior in general, there's a reason for it. So you want to investigate. If it's around the mouth kind of problem, then there are some obvious signs and there are some very hard to see signs. So the obvious one would be drooling. If your dog starts drooling, something's going on. If your dog is pawing at the mouth from one day to the next, there is something going on. If your dog doesn't want to eat, that's for sure. That's a problem. That's a big problem then. Eye infection. It's not commonly known, I think, especially those type of, not the obvious eye infection. The obvious ones happen, they come and go. But the one who you try, your vet or yourself try to deal with it, treat it, and it's not going away or it keeps coming back, then it could be a tooth related problem. And again, going back to the same thing, it's very likely the same tooth that I just showed you before. This tooth, I don't know if you can see it. So this one, this big one. So the roots of this big one, they go really far up and very close to the eye and the eye area. And so according to dentist vets, a large percentage of eye problems are actually tooth problems. Then it becomes an eye problem. So I'm not sure if eye doctors would share this opinion, but there is something to it for sure. It happens. So just keep in mind that if an eye infection happens and it doesn't want to go away, it could be a tooth problem actually. And then my personal favorite, like, but here's another thing. You can, when you feed your dog, you can, and you have a few minutes to spare, just wait and watch your dog, how she or he eats, on which side. Because if it's only one side, that's not a good sign. That means that on this side, there is something going on. So if your dog only uses this side always, today and tomorrow too, and the day after, there is something going on this side. And then to verify that, it's super easy. You look into your dog's mouth, you pull up the gums, and not only just here, just a little bit here, but you go all the way in the back, as far as you can go. And then you look at you notice the color and the texture of the gums, and then the buildup on the teeth. So, and remember that. And then you go on the other side. You again look for the color of the gum, the texture, how it looks, how it feels, and you notice the buildup on the teeth, and then you compare the two. It should be, the two sides should be almost identical, very similar. If on one side there's less buildup, you find, than on the other side, that's a problem. On the side where there is a heavy buildup, a heavier buildup, or more buildup, on that side, there is a problem. There is a loose tooth, there is an infection, there is something going on that side. And your dog is using the other side to chew only because dogs are smart. and they're trying to avoid the pain, right? So then they will use this side only. This side is going to be a lot cleaner, therefore a lot cleaner than the other side. So that's an obvious thing. This is the first thing when we start working with a dog. This is the first thing that we check because it's a very telling sign of trouble, if there is any. So
What
this,
about the bad breath, though? Is bad breath a sign of something going on with the teeth?
tell me again, please.
Bad breath
Bad breath,
is a
yeah.
sign of something going on?
Bad breath is not for sure. Like probably yes, there is something going on in the mouth. Bad breath can also indicate a digestive issue, so it's not always exclusively a dental problem. It could be something else as well. Yes, you want to look into that for sure.
We just got a question from someone. How do you know if your dog has cavities?
Cavities?
Mm-hmm.
Dogs do not have cavities. It's very, 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 very rare. So dogs don't have cavities. Cavities are something that German Shepherds and Labs are known to have. That still is very rare, but it's almost, no, I don't want to say exclusively because it's probably not true, but it's dogs, generally speaking, dogs do not have cavities. They have other type of, okay, let me finish this first. So German Shepherds, Labs, and then the tooth that's involved in that problem is this tooth far back, the first molars, the upper first molars. Almost ever, never something else. And then this goes unnoticed, I think, more often than not, because those type of dogs tend to have good teeth, and unless you are sure that there is something going on, you don't do x-ray, and without an x-ray it's hard to see. But for other dogs, cavity is not a thing. That's not something that we need to be really aware of or afraid of. There are other things. Now there's one other condition that's an interesting one. Oh, this is going to go far. Anyways, there's one other condition that could show signs of cavity, but that's actually not a cavity. That's another problem, and then it results in extractions. So when we, for example, notice that's also a no, that's an out of question thing, extractions are needed. And I can tell you all about that condition if we have time. I'm more than happy to go into that. But that's also, it's more of a cat thing than a dog thing. So cats have that condition more often than dogs.
Got it. And you transition very nicely to my last question before we go to the image. Breeds. So what are the breeds that tend to have the most issues? So you did touch on smaller dogs, but are there particular breeds that we should be aware that have more issues with the teeth?
The micro dogs, the tiny, little tiny, the super tiny, all breeds, any breeds. If it's super tiny, it's going to be a problem. Small dogs in general. And as we go into the picture that's coming up, I'll tell you more about that. Why they often, almost always have serious dental problems. Let me think. There are a couple of things. Just as an interesting fact, Shelties, their upper canines are sometimes quite funky. They tend to stick out a lot more than they should. It's just Shelties, that's their own thing. Sometimes those teeth don't even grow in, actually. Another example would be boxers. Boxers have an interesting condition. It's almost exclusively for them. So whenever we see a boxer, it's the first thing. it is super obvious. It's impossible to miss. So often when you look into a boxer's mouth, you see tiny little teeth, tiny teeth. Um, Now, the teeth are actually proper size, probably, but what happens is that their gums grow over the teeth and they cover the teeth. So it's usually it's everywhere in their mouth, up and the lower. It involves all teeth, usually, not often, not always, but quite often. That's a typical boxer thing. And then to deal with that, you need a dentist vet for sure. It's not a regular vet thing. And they shave off the excess gum, and then fingers crossed that it's not going to come back. It usually does grow back, unfortunately. So that's a boxer thing, for example. Doxies, as much as I love them, the first thing after comparing the two sides, the next thing in a doxy, we'll look for a condition that involves the upper canines, sometimes the lower, but mainly the upper, in my experience. That's also that's a big deal. Extractions, but the solution is extraction, and so they need to have those teeth extracted, likely. Now that involves an X-ray and the vet who is actually familiar with the condition, but yeah, doxies have their own thing. What else I wanted to mention? So small dogs in general could be a Yorkie, Chihuahuas, most small dogs. Another interesting fact: small white dogs tend to have more dental problems than black dogs, for example. It has something to do with their gums, and their gums are more sensitive. And so I often compare that to a skin color kind of thing. So I can spend a day in the sun and nothing happens, and my daughter will burn in half an hour. So on the sun, so it's genetically we are more sensitive to certain things. Genetically, white dogs tend to have more sensitive gums than black dogs. It's not always the case. There are always exceptions to any and all rule. Generally speaking, this is true. Tends to be true. Mm-hmm. What else?
I'm gonna add the image, so give me a minute. I'm going to make sure that we can see it first. There you go. All right, so let us know more about these factors that play a role in our dog's health.
Yeah, so the reason I put together this little chart thing is because when it comes to oral hygiene, the next thing, and usually the only thing we talk about or we think about, is brushing our dog's teeth and chewing, maybe, and then these two. And then if you don't brush your dog's teeth, then we feel really bad if something happens, and then extractions happen. And I hear a lot of guilty. I talk to a lot of guilty dog owners and cat owners, and I think there is a significant piece is missing from this conversation of oral hygiene for our dogs. So I'm not sure if you can see this. I see it it's very small on my screen, so I hope you can see it and get the idea of what I was trying to show you here. So brushing is something that we can do and we can control. And so, as I said, there is so much more to this whole oral hygiene and dental health. So I listed all the things that play this is better. All the things that play a role in our dog's oral health. So diet, home care, lifestyle. Those three are something that you can control. You can actually control. You can control the diet. You can control the home care, lifestyle as well. Lifestyle, I mean chewing Does your dogs play sports, catching the frisbee, the ball, the this, that? That would be lifestyle. And there's a list of things that you have zero control over. And those things play a role as well. So on the chart, on this little donut thing on the right hand side, please don't pay attention to the actual percentages because it's completely insignificant. Is the purpose of this picture is only to show you that there are so many factors that play a role, and this whole thing, the entire thing, is your dog's teeth, your dog's dental health. So the shape of your dog's head play a role. If you have a pug, problems will it's unavoidable. All kinds of dental problems will happen because everything is pushed in the face, right? There isn't enough room for all the teeth to grow in properly. So the shape of the head plays a role. Age plays a role. Young dogs, healthy dogs, everything's great. And then as soon as they start to age and the overall health start to decline or deteriorate a bit, dental health will change. Dental health, the health of your dog's teeth and gums will change as well. Everything shows up in the mouth. Crowding, it's a big one. And this is where all the small dogs come in. Crowding happens when too many teeth grow into a too small space. And where is not enough space in a dog's mouth, then the teeth are going to be on top of each other. That's crowding. Those teeth will not last. You can do the best brushing. You can do the best diet. You can brush your dog's teeth twice a day. Bring your dog to see us every 3 months. Do the under anesthetic cleaning. Those teeth will not last. It's unfortunate. Rotated, overlapping teeth, same thing. Often pugs, Shih Tzus, their teeth are, instead of being nicely aligned, like just in this little chart, like everything is straight and in a nice line. When a teeth can't find a proper place to grow in, there isn't enough space, they will rotate. And when they do that, it's a long story, but the roots of those teeth, it usually involves the premolars, or it could involve any teeth actually. But when it involves, for example, a premolar with two roots, the roots, instead of growing into the bone that holds the teeth in place, instead of growing in properly, when they go sideways, those roots are not embedded properly in that bone. And so they will not last. They will be fine for a while, and then at some point they slowly become loose, and then it's going to be a problem. Extractions need to happen. Genetic predisposition. Genetics, yeah. So poor genetics, like we can blame a lot on genetics, and dental is no different. There is a significant portion of dental health is related to genetics. You have to be lucky in life a little bit, right? So that's the genetics. Retained baby teeth. That's usually is a small dog thing. So frequently, the baby teeth do not fall out on their own, and then they need a little bit of a help. It's often the upper canines or the front teeth. Some dogs have 2 rows of teeth. Extractions are recommended. Absolutely. Now that's something that fairly easily fixable. Interesting fact: if you have trouble deciding which one is which one is the permanent tooth and which one is the baby tooth, for some reason, it's nature, the permanent teeth are always in front of the baby. So the baby is in the back, the front, the permanent tooth is always on the front, always front of the baby tooth. That's just how it is. Deformed teeth, not a common thing in my opinion. On that note, going back to breed specific things, it just reminded me that standard poodles have a condition. Their teeth, like it's actually quite often the case. Like we see a lot of those dogs. Their teeth are brown. Like that pearly white thing is just not happening for them. It's the teeth are healthy, but they're not white. They're just discolored and sometimes deformed as well. Deformed teeth will not last. Deformed teeth will cause problems. They will become loose. They need to be extracted, and they're just trouble. Under and overbite, yeah, we do see that often, right? Especially with small dogs. Uh, it's cute. It's a cute thing, but it's not a good thing. You can't change it. You can't do anything about it. But what happens is, here's what happens often. So when there is an underbite, for example, often the upper teeth are pushing the lower teeth. And every time your dog closes his or her mouth, there is a tooth-to-tooth contact. It's the same thing with upper overbite. There is a tooth-to-tooth contact. And when that happens, the teeth that are touching are not going to last. Unfortunately, eventually, those teeth will become loose and they will become a problem. With underbite and overbite, you also want to make sure that the teeth are not literally digging into the, sometimes the lower canines are go as far as going into your dog's palate, and then there's a hole there. So each and every time, it could be painful. Actually, it could be really painful. So under and overbite, it's a cute thing, but it comes with consequences for sure. Size of the teeth. It's again a small dog thing usually. Larger dogs have proper sized teeth. Sometimes, quite often actually, small dogs have disproportionately larger teeth. Larger teeth than if you were to compare the size of the dog, the size of her teeth, and the size, you look at a larger dog and the size of that larger dog's teeth, and you do the comparison, it's often quite shocking how large those teeth can be in a small dog's mouth. And then there is the bone again that holds those teeth in place. They're just not strong enough to keep those teeth for 15 years. And also yeah, it's a small dog thing. It's very much of a small dog thing. Yorkies, Chihuahuas, they tend to have these type of issues. It's too big, and then also with that size, there isn't enough room, and then comes the crowding. There isn't enough room in that small little mouth for all those teeth to grow in properly. So crowding, overlapping, rotated teeth, problem. So, and then lastly, the mom's diet during pregnancy. That also plays a role. So you have zero control over that. So back to the picture, I just wanted to tell you that there is only so much that you can do and control. And there's a whole bunch of other things that you have zero control over or very little. And so then when it comes to our dog's teeth, in my advice, do your best, um, do your absolute best, keep your dog healthy, but please make peace with all those other factors that you have zero control over, because they play a role, and dental problems happen often. So be in peace with that. Yeah, I hope this was helpful.
It was, Renata. Thank you very much. I appreciate your time and teaching us so much about what to do and not to do. And I agree that there are nuances and exceptions, but this is a very good introduction to how to
Thank
do it, when to seek help. So I appreciate it. And I hope to have you back eventually for
you.
another session.
Thank you so much. It was fun.
Okay. Thank you. So bye. Bye, everyone. It was nice seeing you.
Bye.